Hello and welcome. My name is Jim, aka Dr. Cellini, and on today's episode, I'm going to talk to you guys about something that's a little more serious than usual. I know I kind of get into some diseases and talking about, animal welfare, and that's kind of a serious topic to begin with. But today I wanted to talk about specifically the issue of suicide in veterinary medicine. This is a very serious issue, obviously, and it's one that was brought to my attention even more so than usual because of the recent deaths of multiple veterinarians over the last week or so. And this is just continuing to be a problem in our profession, so I wanted to address this. I wasn't sure how to best address this issue. It's something I've always wanted to talk about and make an episode to discuss, but I think the best way for me to do this would be to simply give my own perspective as far as things that have happened to me and try to maybe extrapolate that to the profession as a whole. So let's get into it. So I thought maybe the best way to present this information would simply be to give an anecdote of my own experience that didn't lead to any sort of, self-harm attempt or anything like that. But I think it illustrates very well how you could become that way as a veterinarian, kind of the stages, and to give people a better idea as far as how this job affects us and to explain how somebody could go down the path of committing suicide. So let me start by just kind of illustrating the case that I saw and take you all the way from beginning to end, from just initially seeing the dog to diagnosing it, treating it, and then the after effects. So I saw a dog, this was a few years ago, I saw a dog that came in to see me for back leg or hind limb weakness and pain. So this was a middle-aged pit bull, if I remember correctly, and the dog was showing signs of basically severe muscle atrophy from about his middle back all the way back. So his back muscles, his abdominal muscles, his legs, everything was just really atrophied. And the dog was in a tremendous amount of pain. Any sort of movement around the hips or to manipulate the legs or touch the back made the dog very, very painful. He would react and try to bite, and he was not a mean dog by any means. He's a sweet pit bull. But the owner described him as just being completely different because he couldn't be touched. So when I examined the dog, I determined that the dog had an issue originating in its spinal cord in what we call the L4 to S3 spinal cord segments, kind of like the very back of the spinal cord where it tapers off. So I presented this information to the owner and offered a diagnostic workup to include an MRI, looking for things like a disc herniation or a tumor or possibly excessive inflammation within that area. So we did an MRI in the dog and found absolutely nothing. Totally normal study. Okay, so we did a spinal tap and we were able to identify a mild amount of inflammation. It wasn't that much, and you would expect with such severe signs to have a diagnostic test also show you a severe abnormality, but it was very mild. But it was enough to tell me that this dog had meningitis overall. In dogs, meningitis is almost always due to an autoimmune disease. If you want to think of it as like lupus of the nervous system, sometimes I make that analogy. It's not perfect by any means, but it's a good way to get people to understand that it's the immune system attacking their own body. So we started treating this dog for meningitis, and basically nothing worked. The dog on subsequent rechecks didn't get better. There was no improvement. He remained in pain, and this owner unfortunately had to try to manage him being both very weak and very painful, despite all sorts of different pain medications and medications aimed at treating both immune-mediated disease, and we also tried antibiotics and different things to try to treat a possible infection. We even tested for possible infections, and we just weren't able to really get anywhere with this dog for weeks, bordering on months. So this is very frustrating. Obviously, as a veterinarian, I got into this field to try to alleviate animal suffering. And this happens a lot, and I'm not the only veterinarian that this happens to, nor is this type of problem the only thing that brings up this issue. But on subsequent rechecks, you're having to see an unchanged problem. Dog remains no better despite what you're doing. And this is very emotionally taxing. So we start treating the dog and treating the dog and treating the dog, and nothing's working. And eventually the owner moves to another state and starts to see another neurologist, and basically was lost to follow-up. So fast forward a few weeks, and I'm on a review site online, and basically I'm looking at my hospital to see how we're doing, because an issue had come up as far as our hospital being well reviewed or not as a whole. We wanted to see if we could improve that. So I'm scrolling through the reviews, and I see a review for me pop up, and I recognize it because I recognize the owner's name. And I read the review, and the review was 1 star, and it was quite scathing. It was calling me negligent and saying how I'm incompetent, and basically just saying that I'm not fit to do my job. It was a very negative review. It was a 1 star review. So I never got this impression from the owner at any point, that this owner had never expressed anything resembling any sort of negativity towards me. Didn't, express anything other than just basically saying okay and being understanding of a very frustrating situation. But I kind of want to pause here for a second and try to get you, the viewer, to understand how this could affect you. So rewind, let's think about seeing a dog who's in a tremendous amount of pain and can't walk, and the dog has no idea why this is happening, but they're just reacting to things and having symptoms. And think about being a vet or a doctor in human medicine. I'm sure they deal with this the same, but no matter what you do, you can't fix this. You can't, no matter how hard you try, you can't fix it. And you stay up at night away from work thinking about this patient, what you're missing. Could you be missing something obvious? Are you smart enough to figure this out? Did you miss something in your training? All of these thoughts go through your head. And again, this is common in human medicine, I'm sure. So imagine going through that and then seeing the animal coming back still in agony, still no better. You're trying everything you can, and you're just exhausting yourself trying to do this. Then go online and find a 1 star review about you, telling you that you're negligent and that you're incompetent and that you just are not good enough, basically. Think about how that would make you feel. Now, extrapolate that dozens of times over the course of your career, or maybe over the course of just 1 or 2 years in your career. How would that make you feel if you had to watch an animal suffer, not know how to fix it, quote unquote, you're the expert, there's nobody else to turn to, and yet you try everything you can and you exhaust yourself emotionally and physically to try to fix this, like you do with every pet that you see, yet somebody wants to just say, you're 1 star, that's it, you're negligent. And to read that about yourself after you have emptied the tank emotionally is an extremely difficult thing to endure. Very difficult. Now, again, I mentioned in human medicine, I'm sure that this happens all the time, and I'm not making an equal comparison to, say, like a pediatric oncologist who can't cure childhood leukemia or anything like that. I recognize that is a completely different scenario and is much worse, frankly, to watch children suffer. The difference is that I don't think an MD necessarily has to go online and listen and read 1 star reviews about themselves like they're a burrito joint that somebody wants to just hate on. Okay? So that scenario, when I read that review, really, before then I wasn't sure I really understood why there was so much suicide. I get that it was a really stressful career, and I understood that there's, student loan issue and the long hours and the low pay. I totally understood that. But to have that actually happen to me, and to read words written about you that are so negative, and then knowing that you did everything you possibly could to help this dog, was a whole nother level for me. Please be aware too, this happens everywhere. Everywhere. Every vet watching this, every vet working in America has to deal with this in some way, shape, or form. I'm actually extremely lucky because I don't have to work overnights to deal with this. I'm not an emergency doctor working overnight shift and suffering from shift work disorder, having sleep issues. I'm able to take enough time off to keep myself relatively healthy, though my wife will probably argue with that, besides the point. But I'm able to take enough time off to keep myself healthy, and I don't have to work 80 hours a week. As a specialist, I'm able to earn enough to overcome my student loan debt and actually still live a very nice life. And I'm extremely fortunate for that. But if those things weren't true, and this is the majority of veterinarians who aren't as fortunate as me, take what just happened that I described. Now picture me working 60 hours, 70 hours a week, all overnights. I'm obese because I don't have the energy to eat healthy. I don't have the money to work out and join a gym effectively. And when I am awake, I'm so tired I can barely even function. Take the scenario of I have $400,000 in student loan debt and I make $85,000 a year. I don't even make enough per month to cover my student loan debt, so I'll never pay it off. Add these things up. Maybe my boss read this Yelp review and called me into the office to chew me out about why their clinic is associated with a 1-star review. I was lucky enough to where my boss didn't care about that. And so that was never an issue. I never once had any sort of discussion, me personally, about, individual reviews like that. It was more just a hospital macro level. But that's not always the case. There's practice owners and medical directors out there who very much value this sort of thing. And they'll call you in and tell you, hey, why didn't you do better? So factor that in. Can you start to see why this might lead to a high suicide rate relative to the general population? It's not a coincidence. These are serious problems with our profession. And what happened to me is mild compared to what happens to most people. And again, I keep saying this, but I'm extremely lucky. I don't have suicidal tendencies. I don't have any sort of risk for harming myself or anything like that. Nor did I after reading that and going through that whole process. But not everybody's as lucky as me. There's a lot of veterinarians out there who are literally destroying their bodies and their minds to try to help animals. In fact, I think you could argue that the majority of veterinarians are doing exactly that. So if anybody's watching this who's a pet owner and is going to see their vet, and let me stop also for a second. I don't think the majority of pet owners are like this. Let me just say right now. But if 3% are, that's more than enough. So if I can put one message out there to pet owners, it's to please understand the only person more upset about your pet suffering than us is you, okay? It's the pet owner, the pet caretaker is the person who's most upset about their animal suffering. And then number 2 is the vet, okay? Because we understand physiologically what this suffering is a lot of the times. So please know don't look at your veterinarian as something to review. Please support them and understand that we're dealing with animals who cannot communicate to us in any way, shape, or form what is wrong with them a lot of the time. Animals evolved to hide clinical signs. Do you think it's advantageous for a dog 2,000 years ago to go around saying, hey, my leg is broken? No. They're going to try to hide it and cover it up. Oh, hey, I herniated a disc. I can't run as fast as I used to. No. Okay? They evolved to hide it. So as a pet owner, if you are thinking about writing a negative review for your vet, I want you to really think about what you're about to say. Would you say it to their face? And how this could affect a veterinarian who is a lot of the times in a lot of emotional and physical distress to begin with. And I want you to take a really, really hard look and say, should I really review this person right now? Should I review the work that they're trying to do and the fact that they're trying to help my pet? Is that really worth a review? Okay? So, again, I'm sorry if this episode was a little bit aggressive. I'm sorry if this episode was a little bit harsh sounding. I'm not trying to put all pet owners on blast. I'm just trying to give perspective from one person who, again, luckily enough, is able to avoid a lot of these mental health issues. But I want to give perspective as far as, on an individual basis, what these reviews mean, what it can do to your psyche, and how it could contribute to a vet wanting to harm themselves. Okay? So, I'll leave you guys with that. Next week, I'll probably get into some more fluffy, fun videos, but I think with the timing of the recent suicides of veterinarians across the country, I think it was more appropriate to try to discuss this issue more than anything else. So with that, I'll leave you guys to it. Again, if you have any comments, want to talk about anything, free to leave a comment. Please also like and subscribe. It always helps the channel, and I'm trying to bring awareness about issues like this to the forefront. I hope I did that, at least to some degree, just now. But again, feel free to let me know if you have any questions, concerns, or if anybody's out there that just wants to talk about stuff. I'm happy to do that as best I can. Thank you very much, and we'll see you next time.